Summary of Diabetes Mellitus. Overview. Diabetes mellitus, DM, is a group of metabolic disorders characterized by chronic hyperglycemia due to various causes. It primarily includes type 1 diabetes mellitus, T1DM, and type 2 diabetes mellitus, T2DM. Type 1 diabetes mellitus, T1DM, pathogenesis, autoimmune-mediated destruction of pancreatic beta cells, leading to absolute insulin deficiency. Epidemiology, often diagnosed in childhood or adolescence, but can occur at any age. Clinical features: acute onset with symptoms like polyuria, polydipsia, polyphagia, and weight loss. May present with diabetic ketoacidosis, DKA. Treatment requires lifelong insulin therapy alongside dietary management and regular glucose monitoring. Type 2 diabetes mellitus, T2DM. Pathogenesis, characterized by insulin resistance and a relative lack of insulin due to pancreatic beta cell dysfunction. Epidemiology, more common in adults but increasing in children due to rising obesity rates. Strong association with lifestyle factors and obesity. Clinical features, often asymptomatic in early stages or presents with nonspecific symptoms. May be diagnosed incidentally. Treatment: lifestyle modifications, oral anti-diabetic drugs, and possibly insulin in advanced stages. Diagnosis: based on fasting plasma glucose, HbA1c levels, or an oral glucose tolerance test, OGTT. T1DM may also involve autoantibody testing, e.g. anti-GAD, IA2 antibodies, and low C-peptide levels. Management: T1DM, insulin therapy is essential. Education on diet, exercise, and glucose monitoring is crucial. T2DM, initial management includes lifestyle changes, metformin, and other anti-diabetic agents as needed. Insulin may be required in later stages. Complications: both types of DM can lead to acute and chronic complications. Acute: DKA and hyperosmolar hyperglycemic state, HHS. Chronic includes macrovascular complications, atherosclerosis, cardiovascular disease, and microvascular complications, retinopathy, nephropathy, neuropathy. Screening and prevention: regular screening for high-risk individuals. Prevention focuses on lifestyle modifications for T2DM, including diet, exercise, and weight management. Prognosis: with effective management, individuals can maintain a high quality of life. Long-term complications can significantly impact morbidity and mortality, emphasizing the importance of tight glucose control and regular monitoring. This summary encapsulates the critical aspects of diabetes mellitus, differentiating between T1DM and T2DM, their management, complications, and the importance of screening and preventive measures. Clinical case: type 1 diabetes mellitus. Patient information: age 14 years, gender male. Presenting complaint: the patient presents to the pediatric emergency department with a 2-day history of vomiting, abdominal pain, increased thirst, and urination. The mother reports that he has been unusually tired for the past week and has lost some weight. History of present illness: the symptoms started mildly but have progressively worsened. The patient also complained of blurred vision and dizziness today. No prior history of similar symptoms. The patient has been previously healthy with no significant medical history. Physical examination: general, the patient appears dehydrated and lethargic. Vital signs: BP 160 mmHg, HR 110 BPM, temp 37.1 RR 24 min, weight loss noted compared to last year's medical record. Skin: dry mucous membranes. Abdomen: soft, mildly tender, diffusely, no guarding or rebound. Neurological: alert-oriented but sluggish in response. Laboratory findings: blood glucose 480 milligrams per deciliter, blood ketone positive, arterial blood gas pH 7.25, HCO3 15 mmol, PaCO2 30 mmHg, indicating metabolic acidosis, HbA1c 12.5%, urinalysis, glucose and ketones present. Diagnosis: the patient was diagnosed with type 1 diabetes mellitus presenting with diabetic ketoacidosis, DKA, based on the hyperglycemia, ketonemia, metabolic acidosis, and elevated HbA1c. Management: the patient was admitted to the pediatric intensive care unit for management of DKA. Initial management included fluid resuscitation with isotonic saline, followed by the administration of insulin infusion and electrolyte replacement according to DKA protocols. Continuous monitoring of blood glucose, ketones, electrolytes, and acid-base status was initiated. Education was provided to the patient and family regarding type 1 diabetes management, insulin administration, diet and lifestyle modifications. Discussion points. 1. Initial approach. Discuss the importance of rapid assessment and treatment of DKA in type 1 diabetes patients. 2. Insulin therapy. Outline the transition from intravenous insulin to subcutaneous insulin once DKA is resolved. 3. Education and support. Highlight the key educational points for a newly diagnosed type 1 diabetes patient and their family. 4. Long-term management. Consider the long-term management strategies for a pediatric patient with type 1 diabetes, including regular follow-ups, HbA1c monitoring, and screening for complications.